My journey with SAMI started when I was a teenager in my former church. There was a fundraising at that time, so they needed people to come in to like usher and help with some of the activities. So I said, oh, since my desire right from when I'm young is to help people, so I was like, oh, there's an opportunity to like be of use to someone. So from then I became the family of SAMI.
The vision was just there. You can feel the impact of the vision, but we don't really have a structure to it. So, of course, some of us have to do the groundwork. At times, we will be like, I didn't know this thing would be this serious. So, but when you look at the bigger picture and you look at the results you get, the smile you put on people's faces, that is what spurs you on.
You see people who maybe because of their ailment, they feel they are different from you, but the thing is, we are all human beings. Me joining them is an opportunity for me to help. Like, okay, let them see that, oh, there is someone who supports them, despite the fact that she's not suffering the same thing. She's sharing her pain, she's sharing her joy, we share in their happiness, so that's why I'm here. If you look at the people in which we'll deal with, these are people who, even their daily meal, they can't afford it. But for us to be able to contribute a little, even to their drugs that will last them to a month, you could feel the joy that, oh yes, at least if I can't buy the drugs, I have the opportunity to get the drugs somewhere.
SAMI is an NGO dedicated to help people living with SCD. Actually, they provide the best free clinic, free drugs, and lots more. When I come to SAMI, I feel free, I feel lively. I feel like I'm with my family, with people that understand me fully, well enough to know what's wrong, and people I can confide in.
I've been coming here since 2015. By that time, I had back pain. They asked us to go for X-ray. And then SAMI, they were the one that gave us the money for the X-ray. We came back. We told them the feedback that we have done the X-ray. They said it's scoliosis. And since then, they have been giving us drugs. Everything they have been giving us, all the drugs, is free.
From that 2012, we have been coming. And apart from the benefits we get through the drugs, then the checkup, we will meet other children and other people with the disorder. And you will know that, yes, even with the disorder, there's still hope. That's not the end of the world. It encourages people at least to get counseling. Once there is anything, if you should call them, they will tell us what to do about it.
Satisfaction working with sickle cell advocacy is the smile you see on the people's face. Sometimes you come to the clinic, for example, they're happy to see you. They are happy that this is someone that is adding value to our life.
This is my passion. This is what I love to do. The ability to be there, the ability to stand by people, just make a difference.
I started SAMI more out of a calling than anything else, because I've been living with sickle cell for over 5 decades now, and I had a tumultuous life living with sickle cell. But sometime in my life, I wrote an autobiography, and I was invited to a TV program back then. And somebody was like, okay, why don't you be an advocate for people with sickle cell? And I was like, no, that's not my problem. I have my own issues. But God, shall I say, forced my hand to start this NGO when I had a call from somebody who said he's living with sickle cell. His parents don't want him to go to school because they feel he's going to die anyway. And that's when I realized there was really an issue that had to be dealt with. And that's how I started the NGO. And basically it's to help people living with sickle cell and their families to live healthy, productive lifestyles. So I realized we had to be more involved with the people with sickle cell. It's not enough to just motivate them or inspire them. We had to get them to understand their health is very important in managing. And what we realize is that a lot of times, because of financial issues or because of the challenges of going to a public health service or public hospital in this country, people leave their health issues till it's very late. and then they either need more money to solve the problem or they lose their loved one. So we decided to start a clinic to be a bridge between the person living with sickle cell and the hospital, so that when we spot anything, we'll be able to notify them and, if possible, help them so that they can get attention at an early stage. So we started this free clinic where we provide free drugs. We have doctors who come and consult on a monthly basis, and we found that has reduced the number of times people have had to go to hospitals. It has reduced the number of times people have faced major challenges in terms of their health care, because we've been able to spot where the challenges lie and empower them. Especially the medication has been so much of great help, because most of the time the parents can't afford to buy the drugs, and when they see free drugs, is an opportunity to help the child to live better and then focus more on other issues rather than their health, because we're helping them with their health. Our belief is that this clinic is very important. It's helped a lot of people, but we want to go beyond that. We want to see situations where I have crisis in the nights. There's an ambulance I can call 24/7. Because with us, with sickle cell, crisis happens at 2 a.m., 3 a.m., and where do you get transport around that time? So there's need for a better transportation system in terms of getting people to the hospital on time, so that self-medication is not increased, because we have a lot of people who are addicted to pain meds because of the challenge of reaching to the doctor on time, getting access to the hospitals on time, and they begin to self-medicate and results in addiction. And then young people who are neglected by their parents, who their parents feel you are old enough to look after yourself. We forget about your health, we forget everything about you, or you're abandoned. There's a home they can come to where they are not only treated medically, but they are also empowered, they are taught soft skills so that they can become independent and become self-sufficient on their own. So that's our dream for the organization.
Access to funding is one of the things that is really, really necessary for SAMI, because basically most of the projects we do are projects that impact people directly. You don't really need even to promote it. There are projects that promote themselves. Okay, one person's life is affected, the person tells another person, tells another person. So with time, you have more people than we can handle. Example is the clinic. When the clinic started, it was less than 100 families. In less than 2 years, you are looking at over 400 families constantly coming for the clinic. And the numbers keep growing. So we need the funding. One of the major places where the fundings go is getting these professionals, the technical know-how people from doctors, nurses, labs, special lab assistants, and so on. So you still need professional hands in that aspect. Then also publicity. We need more people to come in, tell the world what SAMI is doing, so that a whole lot of people can be part of it.
Sickle cell is not an us issue. It's not a my issue. It's everybody's issues, and it's something that we all need to be involved in. And until we put our heads forward and try and reduce it, try and also empower those who are already living with it, because we are very intelligent people. What God has removed in our strength is giving us in our mental capacity, and there are a lot of people who have the capacity to do a lot of things that just need the support, and so help the organization to help other people.